Hi everyone, my name is Marie Dean, and I want to talk to you about a phenomenal woman by the name of Ida Jean Orlando. Many of you may know her behind the nursing process. For those of us who study nursing currently or have any previous experience with nursing, we are very familiar with the nursing process. But before I get into that, I want to tell you a little bit more about her. She was born in 1926, an Irish American. She received her diploma in nursing from New York Medical College. She also received her nursing of bachelor's in science and public health from St. John's University and her master's of arts degree. She's an internationally known theorist, researcher, and psychiatric nurse. She developed the deliberative nursing process theory. That theory includes the data that we use to form care plans or care for our patients. These include assessment, diagnosis, nursing diagnosis, planning, implementation, and evaluation. Some people call it ADPI, just to shorten that up. She contributed to helping nurses make nursing diagnosis and care plans. This is what makes her so great. In the process of doing this, she was an associative professor at Yale. While being that associative professor at Yale, she was head of a research project. She used that research project to help form this nursing process theory. From this nursing process theory, she came up with, it was processed into two different publications. These publications include The Dynamic Nurse-Patient Relationship, Function and Principles, which was published in 1961, and another publication which was published in 1972 called The Discipline and Teaching of Nursing Evaluative Study. She has since been published in many different nursing books throughout the history since these publications came out. I like to think of her as a leader because I think when she was doing that research, she had no idea of the impact that she would have today. She didn't know that years and decades from now that people will be adhering to her nursing process. As I discussed earlier, it is also known as ADPI. I want to tell you a little bit about which each mean. The assessment data means you look at your patient, assess the nonverbal and verbal cues to try to help you figure out what may be wrong. The nursing diagnosis is used from those assessment cues and things that you see and watch and that they tell you. That's how you form the nursing diagnosis. But it's not like a medical diagnosis. It cannot be medical. It has to be a nursing diagnosis. We now have a book today known as the NANDA book that helps us nurses figure out which nursing diagnosis best fits our patient. Also in the book, it also includes the planning portion of how to help plan the care. The planning is what we plan to do to help our patient better themselves or get well. The implementation piece are the interventions and things that we actually do to help these patients get better. The evaluation happens at the very end, and we evaluate whether those interventions and planning methods that we did worked. If they didn't work, we start over with a new set of plans by doing that assessment data all over again. I think that she is a phenomenal woman. And I also think that she identifies with some of the leadership skills and qualities that we have learned about throughout this course. I think of her as a servant leader personally myself, because I think when she was researching these things and trying to come up with this nursing process, she was thinking of how to help her fellow nurses, not how to better herself, but how to make nurses all around better in what they do. This includes caring for their patient, making care plans, and seeing them through their care. I don't think that she did it for self-gain, but to help everyone in the nursing world become better at what they do. This has been proven to be effective through research and science. It has been proven to be the correct method and correct way for us nurses to be able to know the needs of our patients. She has also been included in publications outside of the ones that I discussed earlier. She's been published in nursing books all throughout the world since this process was developed. I think this is what makes her an amazing leader. And to think that she was just doing a research project before and this has become so big of this. I think this makes her an amazing woman. I hope I was able to shed light on her importance in the world and in the nursing world. I hope you all have enjoyed my presentation and got something from it. Thank you all, and you have a wonderful day.